I am Dr. Jason Lee from the University of California, San Francisco, and this is the CJSIN podcast. On behalf of my co-authors, I am pleased to discuss our findings in prognostic value of ambulatory blood pressure load in pediatric chronic kidney disease. We know from one large European trial that tight control of blood pressure is important for slowing progression of chronic kidney disease in children. The accurate diagnosis of high blood pressure in children has relied heavily on the use of 24-hour ambulatory blood pressure monitoring. Blood pressure load is a parameter that can be derived from 24-hour ABPMs. It is defined as the proportion of elevated blood pressure readings detected over a 24-hour period. A blood pressure load greater than 25% is considered to be elevated. In adult guidelines, blood pressure load is generally not considered as part of the criteria for the diagnosis of hypertension. This practice is different in children, where both mean blood pressure and blood pressure load are used to interpret reports. Typically, both metrics are elevated in hypertensive cases, but a major point of diagnostic uncertainty comes up when only the blood pressure load is elevated, but mean blood pressure is not. It is not clear whether these individuals should be considered hypertensive under such circumstances. In this study, we wanted to understand whether blood pressure load independently predicts risk of adverse cardiac or kidney outcomes, and whether it provides additive prognostic information when used in conjunction with mean blood pressures in children with CKD. We used data from the Chronic Kidney Disease in Children cohort, or CKD study, which has performed ABPM and echocardiograms every 2 years since its inception more than a decade ago. CKD participants have been followed for onset of end-stage kidney disease. We determined the proportion of children who had normotension, isolated blood pressure load elevation, or ambulatory hypertension. We then evaluated whether elevated blood pressure load was associated with either left ventricular hypertrophy in cross-section or end-stage kidney disease longitudinally as our primary outcomes of interest. We also determined the ability for blood pressure load to provide independent or additive risk discrimination for outcomes of interest using Harrell's C-statistics. In 533 CKD participants, we found that nearly 1/4 of the cohort had isolated blood pressure load elevation and over 1/3 met the criteria for hypertension. Left ventricular hypertrophy was present in 12% of the cohort at baseline, and about 1 in 4 children reached end-stage kidney disease during follow-up. Compared with the normotensive subgroup, isolated blood pressure load elevation was not associated with left ventricular hypertrophy or with end-stage kidney disease in either unadjusted or adjusted models. Every 10% increase in awake or sleep blood pressure load was not associated with left ventricular hypertrophy or risk of end-stage kidney disease. The C-statistic for blood pressure load was low at 0.6. When we added mean awake or sleep blood pressures to our models, the C-statistics remained low. In summary, our results suggest that blood pressure load does not associate with the risk of adverse outcomes in children with chronic kidney disease. Blood pressure load also does not appear to provide strong risk discrimination for left ventricular hypertrophy or end-stage kidney disease either independently or when used in conjunction with mean ambulatory blood pressures. Our findings do not support the prognostic value of blood pressure load, but future studies are needed to confirm our findings in other pediatric populations with chronic kidney disease.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.